Come in.
Hi, I'm Brianna. I'll be your student nurse today. I'm doing some hand hygiene and employee some privacy, okay? Can you just verify your name and date of birth for me?
Yes, Mackenzie Smith, 5205.
Okay, is it okay with touching Mrs. Smith?
Yes.
Alright, I'm going to check your armband. Alright, you are Mrs. Smith. Are you allergic to anything, Mrs. Smith?
I am not.
Alright, so I'm just going to check some orders from the doctor really fast, okay?
Okay.
Check the orders. So the doctor's ordered us to do a full head to toe physical assessment on you today. Is that okay?
Yes, ma'am.
Alright. Can you state your full name for me?
Yes, Mackenzie Amaya Smith.
Alright. And do you know where you're at, Mrs. Smith?
Yes, Middle Georgia State University.
Okay. And do you know why you're here?
Yep, for a physical assessment.
Physical assessment. Perfect. And do you know what year we're in?
Yes, 2025.
Alright. So my patient is alert and oriented ×4. So really fast, I'm just going to inspect you really quick. Just sit there and look pretty, okay?
Okay.
So scalp is all good. No signs of head trauma, no edema or anything, no lesions. That looks good. So let's see, face looks good, eyes, ears, nose, everything's symmetric, trachea is midline to the body. Can you just swallow for me really fast?
Mm-hmm.
Perfect. Do you have any headaches recently?
Mm-mm.
Any blurred vision?
No.
Any runny nose?
No.
What about a sore throat?
Mm-mm.
Any difficulty swallowing?
Nope.
And any recent ear infections?
Nope.
No? Alright, so now I'm just going to assess some things in your eyes and your nose and stuff like that, okay? Is that okay?
Mm-hmm.
Alright. Real quick, I'm just going to assess your pupils. Let's see. Pupils are about a 4 right now. I'm just going to shine this light into your eyes if you'll just look straight ahead, okay?
Okay.
Alright. And just follow this pin for me, okay?
Mm-hmm.
Perfect. So pupils are equal, round, and reactive to light and accommodations. Now for your nose, can you just hold one side and blow for me? Perfect. Hold the other side, blow. Perfect. All right, I'm just going to look into your ears really fast, okay? Pull your ear back. All right, so there's no redness or edema. Cerebrum is present in that ear. Let's go to your other ear.
Okay.
We'll pull it back. All right, no signs of edema or redness. Cerebrum is present in there as well. Can you smile for me really fast? Perfect. Smile. Can you open and say, ah? Mucous membranes are intact, moist, and pink. No signs of thrush. Tongue was real good color pink. Let's see. And really fast, I'm just going to check your skin and stuff. So skin is a nice color. I'm just going to touch you, okay? All right. Temp is a good warm color. And I'm just going to check for any dehydration.
Okay.
All right, so no dehydration. Skin elasticity is perfect. And how's your appetite been lately?
It's been good. I get all my 3 meals in.
Okay, so nutrition is good.
Mm-hmm.
Okay, good. And are you able to sit up on the side of the bed?
Mm-hmm.
At times and move around, good, so mobility is good. And my patient has good sensory perception. She uses verbal command to whatever I tell her, so she's good with that. And I'm just going to perform a quick little hearing test on you, okay? So I'm going to stand behind you, a couple of feet behind you, and whisper some numbers if you'll just repeat it back to me, okay?
Okay. 1, 2, 3, 4, 5.
Okay, I'm going to come to the other side.
6, 7, 8, 9, 10.
All right, perfect. So hearing is all intact, all of that as well. And now I'm just going to move on to your respiratory assessment, okay?
Okay.
Are you having any shortness of breath?
I am not.
Okay, any cough?
Nope.
Any mucus?
No.
All right. I'm going to listen to some different breath sounds, okay?
Okay.
I'm in her right upper lobe, left upper lobe. And if you'll just displace this breath for me, left lower lobe. And if you'll take this hand to the shoulder, left lower lobe laterally. Okay, and if you'll displace this breath for me, right middle lobe. Okay, and that hand to that shoulder. And right lower lobe over here laterally. Perfect. Now I'm going to get you to turn. I'm going to listen to some breath sounds on your back, okay?
Okay.
So I'm in her right upper lobe, right lower lobe, left lower lobe, and left upper lobe. Perfect. So no adventitious lung sounds bilaterally. All of that sounded great. Mrs. Smith, I'm just going to educate you on this incentive spirometer I need you to use, okay? So this will be your incentive spirometer. I need you to inhale to this for 2 to 5 seconds, then exhale. I need you to do this 10 times every hour. Or if it helps you remember, I want you to do it on commercial breaks, okay?
Okay.
All right, so can you demonstrate what I just taught you? Perfect. And can you just verbalize back to me what I just taught you so I know you understand?
Yes. Breathe in, hold it for 2 to 5 seconds, and do it 10 times every hour.
Perfect. Okay, I'm going to take this from you. All right, and if you were a bedridden patient at Mrs. Smith, I would get you to do a turn, cough, and deep breath. So you would turn, say on your left side, you would cough and take a deep breath, and 2 hours later, you would do it again. You would turn, cough, and take another deep breath, and you'd alternate that every 2 hours, okay?
Okay.
All right. So everything looked good for your respiratory assessment. So I'm going to go ahead and move on to your cardiac assessment. Are you having any chest pains?
I am not.
You're not? All right. I'm going to listen to your different valve, your heart real fast, just some different valve sounds, okay?
Okay.
So I'm in her aortic valve, her pulmonic valve, her Erb's point, her tricuspid valve. And if you would just displace this breast for me, this is going to be her mitral valve, and this is also where I can assess her apical pulse. I would listen here for 30 seconds. If she has a regular beat, I would listen for 30 seconds. If it's irregular, I would listen for a full minute. All right. So all of that was good. S1 and S2 were present. All that sounded good, okay? Can you just reach your hands out like this for me? I'm going to check for any edema, okay?
Okay.
Perfect. And I'm going to check your capillary refills while I'm at your hands. And nails look good, groomed, a good shape and color, no clubbing or splitting. Nails do not feel spongy or anything. Capillary refills are less than 3 seconds. I'm going to check some edema in your legs, okay?
Okay.
Perfect. All right, and then I would have my patient sit at a 45-degree angle. I'm going to check her for any jugular vein distension. So if you'll look to your left for me. All right, and I'm going to step this side. If you'll look to your right. Okay, no JVD present. All right, and really fast, Mrs. Smith, I'm just going to check some different pulses for you, okay? And are you having any itching or anything on your body?
Mm-mm.
No? Okay. All right, so I'm going to check her radial pulse. Pulse is a regular 2 plus volume. I'm going to check her left one. Pulse is a regular plus 2. And while I'm over here, I'm going to go ahead and do her posterior tibial pulse. And that's also a regular plus 2. While I have her on her left foot, I'm going to do her dorsalis pedis pulse. That's a regular plus 2. Now I'm going to come over here and do her right side. So I'm in her posterior tibial pulse. So regular plus 2, do her dorsalis pedis pulse, a regular plus 2. So all of that looked good. They were all regular plus 2 pulses. They were palpable. And some different pulses that I could assess for Mrs. Smith is her carotid pulse right here, her axillary pulse right here in her armpit, her brachial pulse in the bend of her arm, her femoral pulse in her groin area, and her popliteal pulse behind her knee. So all of that sounded good. You feeling okay, Mrs. Smith?
Yep.
All right, so now we're going to move on to your gastrointestinal, okay?
Okay.
Are you having any abdominal pain?
No.
And can you tell me when your last bowel movement was?
Last night.
And was it regular or irregular?
It was regular.
Okay. And are you going, is it regular every day or is it
It's regular every day.
regular? All right. So really quick, I'm just going to listen to some different bowel sounds, okay?
Okay.
So I'm going to start in your right lower quadrant. And if I heard bowel sounds here, I wouldn't have to go to the other quadrants. But I'm going to go ahead and listen to the other quadrants. Her right upper, left upper, left lower. Okay, perfect. Now I'm just going to palpate your stomach, okay? So you might just feel just a little pressure, okay? Let me know if you feel any pain, okay? good. Did you feel any pain?
No.
No. Did you feel any tenderness when I pressed down?
No.
No. Okay, so the stomach was not distended. Her bowel sounds were normal, active bowel sounds. So all that sounded good. Are you having any difficulty urinating?
No.
No. Is it any burning or anything like that?
No.
No. And when you usually urinate, what color does it appear?
Look a clearish yellow color.
Okay. Is there any odor or anything with it?
No.
No? All right. So I'm going to go ahead and move on to your musculoskeletal assessment, okay? So we're just going to practice some range of motions and stuff like that. If you don't mind, if you would just scoot the chair back just a little bit for me. Perfect. Do you have any history of falls?
Nope.
No. And you have any recent falls?
Nope.
No. All right. So I'm going to do some range of motion in your arm first, so we don't have to stand up yet, okay?
Okay.
So we're going to do your elbow. So this is the elbow joint, and I'm going to get you to flex up. This is flexion. Back down is extension, okay?
Okay.
Perfect. Now I'm going to do it in your other arm. So we'll flex up, flexion of the elbow, back down, extension of the elbow. All right, now Mrs. Smith, if you'll just put your fingers out like this for me. This is your finger joints. If you'll spread them apart, okay, that is abduction, and back together, adduction.
Okay.
I'm going to feel your other joints. All right, so we're going to go apart, which is abduction, and back together, adduction. Perfect. So no crepitus in the upper extremities, all that was good, okay?
Okay.
So if you'll go ahead and stand up for me. All right, we're going to do some range of motion in your lower extremities.
Okay.
So in your knee joint right here, if you'll just flex your knee back for me. Okay, that's flexion of the knee, and back down is extension of the knee. Perfect. Now I'm going to go over here and do the other side. So flexion of the knee, extension of the knee. Perfect. So no crepitus in the knees. That was all good, okay? And then one other thing I'm going to teach you is some abduction, adduction of your hip bone, okay?
Okay.
So I'm going to go on this side of you. So what I need you to do is just going to take your leg and go out for me. And this is abduction of the hip, and back in would be adduction, okay?
Okay.
So now we're going to do the other hip. So abduction and adduction. Perfect, no crepitus in the hips or anything like that. And if you'll just squeeze your hands for me. Squeeze, good. I need you to push against me. All right, and push against me again. Perfect, strength is good. All that's good. You can get, one more thing, we're gonna do your Glasgow's coma scale. Then I'm gonna get you a walk for me, okay?
Okay.
So if you'll stand, put your arms by your side. I'm just gonna check for any swaying, okay? Perfect, no swaying. All right, now we're just gonna check your gait and balance. If you'll just take a few steps for me. On your way back, just do heel to toe for me. Perfect, that all look good. You can go ahead and sit down so your gait and balance is on tight, all good. Do you have any questions for me right now?
No.
All right, so I'm just gonna do some quick patient safety, okay? Let's make sure the floor is decluttered of any kind of mess. Let's make sure cords are put away before we get up and walk. Let's make sure the lights are turned on so we can see before we get up and walk, okay?
Okay.
Do you have any questions?
No, thank you.
All right, well, I'm going to do some hand hygiene for your privacy, okay? You have a nice day.
Thank you. Bye.
Bye.